Do you use CPT in your day-to-day coding activities? And do you code in the 30,000 series of code? Well, in this video, we'll take a look at the respiratory system and check out the 2018 updates, the new, revised, and deleted codes in the respiratory system. Hello. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. In the respiratory system, there are 7 new codes, 1 deleted code, and 6 revised codes. Codes 31241, 31253, 31257, 31259, and 31298 have been established. The guidelines in the endoscopy subsection of the respiratory system section have been revised, and codes 31254, 31255, and 31276 have been revised. In addition, parenthetical notes have been added and revised throughout the respiratory section to conform with those changes. These changes have been initiated because of a survey requested by the AMA RUC-RA, which identified the current code family as being potentially misvalued. It was determined that adding and revising these codes would provide a solution to the family of surgical endoscopic services. As a result, code 31241 may be reported for a nasal or sinus endoscopy with ligation of sphenopalatine artery. Code 31254 has been revised to a parent code with 4 codes in its family. The new family of codes 31254, 31255, 31253, 31257, and 31259 should be used to report surgical nasal endoscopies with ethmoidectomy, partial, anterior, or posterior, including frontal sinus exploration with sphenoidotomy and sphenoidotomy with removal of tissue from the sphenoid sinus. In addition, the guidelines referencing codes 31231 through 31235 have been revised to provide instruction on the use of modifier 52 or modifier 53, depending on the circumstances of the examination. Code 31320, laryngotomy, thyrotomy, laryngofissure diagnostic, has been deleted due to low utilization and to ensure that the CPT code set reflects current clinical practice. Code 31645 has been revised with the removal of the example drainage of lung abscess. Similarly, code 31646 have been revised with the addition of the phrase same hospital stay to specify that the initial therapeutic aspiration of the tracheobronchial tree is performed at the same hospital stay. Code 31645 was identified by the AMA RA as potentially misvalued. The instructional parenthetical note that follows code 31646 has been revised to instruct users to refer to code 31725 when reporting catheter aspiration of the tracheobronchial tree with a fibroscope at the bedside. The phrase "with fibroscope" has been added to the parenthetical note because code 31725 was revised in 2017 to include the use of a fibroscope at the bedside. The parenthetical note that follows code 32674 has been updated to include a list of the esophagectomy procedures that include a fluoroscopic component, for the removal procedure. Refer to the code book and the rationale for codes 43286 through 43288 for a full description of the changes. An instructional parenthetical note has been added to lung transplantation guidelines to direct users to the appropriate codes when using or reporting ex vivo assessment of marginal donor lung transplant. Also refer to the code book and the rationale for codes 0494T, 0495T, and 0496T for a full description of the changes. Also, code 0340T has been deleted from the Category 3 codes and converted to Category 1 code 32994. In addition, code 32998 has been revised to accommodate the establishment of code 32994 to report ablation therapy of pulmonary tumors performed via cryoablation. An instructional parenthetical note regarding the appropriate reporting of this procedure has been included. Code 32994 has been established to allow the appropriate reporting of ablation of pulmonary tumors using cryoablation. Code 32998 has been changed into a parent code. A semicolon has been appended so that the new code uses similar language in the descriptor. In addition, code 32998 has been revised by the addition of a phrase that identifies the use of imaging guidance when imaging is used for the procedure. Because these procedures are commonly performed unilaterally, the term unilateral has been added before the semicolon so that the term is part of the common language for both the new and revised codes. Because the procedure may be performed bilaterally, instruction has been provided to direct the use of either code with modifier 50 appended in order to identify the bilateral procedure when it's performed. In an effort to provide further guidance regarding the intended use of these codes, instructions have been revised in other sections of the CPT code set to reflect the addition of the ablation code. This has been accomplished by listing the new and revised codes in parenthetical notes to include ablation as a procedure that may be reported when appropriate. Are you interested in the field of medical coding? Well, we offer an online medical coding course just for you. Click the link in the description box below for details on our online medical coding courses. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care.